Greetings, everyone. Welcome to the 116th session of the online Optom Learning Series, OOLS. And for today's session, we have with us Dr. May Ho. She is graduated from the University of Melbourne in Optometry, where she also gained her PhD. Dr. May is in the medical term of the Fred's Hollow Foundations as Optometry and Primary Care Advisor. She is currently based in Australia, and Dr. May is working on the implementation of the Foundation's refractive error strategy and integrating into the program activities, which includes a part of cataract surgical outcomes as well. She has worked on the development of sustainable eye care programs in various countries in the Asia Pacific, in the European continent, African continent, and also the Caribbean regions. Previously, together with in-country partners, she has developed the first optometry education program in Vietnam. And for this, in recognition of her work, she was awarded international by the IAPB as the eye healthcare hero in 2019. And currently she serves on the IAPB board, International Agency for the Prevention of Blindness, in the low vision working group and school eye health working group category. She is also the member of the education subcommittee of the World Council of Optometry and of the Education Advisor Committee of Optometry Victoria, South Australia. She is also a fellow of the Australian College of Optometry. So with all that experience, I think most of her experience lies in education, public health, and today she's going to talk to us about the role of optometry in prevention of blindness. And this talk, she's going to take us through the latest in this particular aspect. And let's just hear it from her. So welcome, Dr. May, onto our platform. Let me just leave the screen time to you.
Okay, thank you for the kind invitation to present and for the opportunity to talk to everyone. I think you've heard this various versions of this presentation a few times now, so hopefully I can do the topic justice. Okay, so I would like to start by acknowledging the traditional owners and the custodians of the lands on which I work, which is the Wurundjeri people of the Kulin Nation, and also of the traditional owner and custodians of the lands where you are, and recognize their continuing connection to the land, waters, and community. I pay my respects to them and their cultures, and to elders both past, present, and future. So the learning outcomes today would be to be able to list the main causes and prevalence of vision impairment globally, and to describe the role optometry can play in blindness prevention. So I will go about this by talking about how many trends and progress, what are the causes, and what can be done about this. But I won't be doing the case studies. I don't think we have time for that. So there's been a lot of publications in coming up to 2020 about the magnitude of vision loss. And this is the Global Vision Database that is part of the Vision Loss Expert Group. So it's an international epidemiology reference group of mainly ophthalmologists and optometrists with experience in ophthalmic epidemiology. So they convened in 2007 to assist the global burden of disease study, and they populate and curate the Global Vision Database. So it's a continuously updated comprehensive online database which stores worldwide ophthalmic epidemiological information. So they've published a couple of papers on blindness and vision impairment, both distance and near. So that was published back in 2015 or 2018, I think. And then a more recent one looking at blindness and vision impairment in 2020. So these are all key papers that if you're interested, you should have a look at. But they are also nicely summarized for you by the Vision Loss Expert Group and the IAPB. They conceived this concept of a vision atlas in 2016 as a means of disseminating to anyone country-specific prevalence data. So you can go to the Vision Atlas and look up information for your specific country. And it's a translation of the two papers or the work of the Vision Loss Expert Group that you see. And it's sponsored by 6 different organizations, of which the Fred Hollows Foundation, where I work, is one of them. Now, a lot of this information that I'm providing to you is from those 2 papers that I talked about, and also drawn a lot from the Vision Atlas and the next paper that I'm going to show you, which is the Lancet Global Health Commission paper, which was only released maybe a couple of weeks ago. So I would like to acknowledge the assistance of IAPB Head of Knowledge, Jude Stern, who has provided me some of these slides to use. Okay, so as I said, maybe 2 or 3 weeks ago, the Lancet Global Health Commission published a paper on global eye health, Vision Beyond 2020. So this report builds on the worldwide initiative for the elimination of avoidable blindness, and it's the publication of the WHO's World Report on Vision in 2019 and the 73rd World Health Assembly Resolution on Integrated People-Centered Eye Care, which came through in 2020. So the Lancet Global Health Commission on Global Eye Health is the work of an interdisciplinary group of 73 academics and national program leaders and practitioners from 25 different countries. So this is their website. So if you want to have a deeper dive into what they found, you can go to this website. You can download the paper and have a look at the information that they have uncovered. So I'll go through some of that in this presentation. But if anyone is interested, I think this paper is almost like a textbook on global eye health, because it explores every single aspect of eye health that I'm going to talk about today. So most of you would be familiar with the WHO classification for vision impairment. So we know that mild vision impairment is between 612 and 618. Moderate vision impairment between 618 to 660. And severe vision impairment between 660 to 3/60. And blind is worse than 3/60, or visual field of no more than 10 degrees in radius around central fixation. There's also near vision impairment, which is N6 or worse than N6 or N8 at 40 centimeters with the best corrected visual acuity of better than 612. So some of the information I'll be talking about might reflect on the GBD super regions. So you can see from this map here how the countries are grouped into the super regions. So you've got the high income countries in brown, Southeast Asia, East Asia, and Oceania in that orangey color, which I think most of you are from, and South Asia as well in blue. Okay, so the reason they've broken it up this way is that they needed to separate China and India, because these 2 countries have huge populations. And if we were to have an Asia region with both India and China in it, it will skew all the data. So that's why they've divided into 2 regions. So then you have North Africa, Middle East, and Sub-Saharan Africa, Latin America, and the Caribbean. Okay. So blindness and visual impairment. So when we talk about visual impairment, this is not including mild visual impairment. We're looking at 2.2 billion people globally who are blind or visually impaired. And this includes those who have been treated. But if we were to look at avoidable blindness and visual impairment in 2020, when the global population is 7.8 million people, we know that 43 million people are blind and 295 people have moderate or severe vision impairment. So that is equivalent to 338 million people with vision impairment. So when I say vision impairment or visual impairment in this presentation, it refers to blind and moderate and severe vision impairment. But if we were to take into account people with mild vision impairment, which is vision worse than 612, between 618 and 612, because we know that if you have vision worse than 612, you actually can't function very well. And legally, you can't do certain things in certain countries. So for example, in Australia, if you have vision of worse than 612, you're not allowed to hold a driver's license. So you can't drive a car, which for a lot of people, it has a huge impact on what they can do. So if we take in people with mild vision impairment as well, then we're looking at 596 million people with vision impairment. So if we look at blindness and visual impairment distribution across the globe, you can see that, you know, the South Asian region and the Oceania, Southeast Asia, or the Southeast Asia region, which has the highest numbers. Right? So 335 million in South Asia and 287 million in Southeast Asia. And if we were to look at visual impairment and equality, we can see that visual impairment is not distributed equally. So overall, women are 12% more likely to have vision loss, and they're 8% more likely to be blind, and 15% more likely to have moderate or severe vision impairment. So, and this is because the average life expectancy of women is longer than men. And many eye conditions such as cataract, presbyopia, glaucoma, and age-related macular degeneration are associated with increasing age. And in many countries, women also have less access to health services due to various social, economic, and cultural barriers. So it could be because of cost. So women would often have less access to family financial resources to pay for eye care or transportation to reach services, inability to travel. So they may have fewer options for travel than men. So in some societies, women can't travel by themselves. And older women may require assistance, and poor families cannot provide that sort of assistance. So lack of access to information and resources. So female literacy can be lower than for males, especially among the elderly population. So as a result, women can be less likely to know about the possibility of treatment for eye disease and where to go to receive it. And as optometrists, we know that the older you get, the more likely you are to have visual impairment. So 73% of all the people who are blind and vision impaired, 73% are in older adults, so age 50 and over, and then only 8% are children and adolescents. Okay, so children will be under 18, and then adults would be over 18 to 50. Rates of vision loss increase with every decade above 50 years as well. So health promotion and early detection can delay and prevent many causes of vision loss. So what are the main causes of vision impairment? So if we look at it from a public health perspective, there are diseases that are easy to prevent or treat, such as trachoma, onchocerciasis, or diabetic retinopathy. Well, that's not easy to treat, but it's preventable. And vitamin A deficiency. Then there are diseases that you can treat, like cataracts or refractive error. So there are interventions that are available. And then there are the diseases where there's little evidence of cost-effective options, such as glaucoma and age-related maculopathy. So with diseases like glaucoma and age-related maculopathy, they have impact on individuals, but the issue with the treatment and the diagnosis and the follow-up, especially with diseases like glaucoma, you know, as optometrists, that this is quite difficult to do. Whereas in the top two category, the diseases that can be prevented or treated, like trachoma, diabetic retinopathy, or onchocerciasis, vitamin A deficiency, you can actually prevent them. So therefore, a lot of public health activities would be focused more around the diseases that we can prevent and treat cost effectively. So what are the causes of blindness and visual impairment? So we know that cataracts and refractive error are the main ones. So 90% of visual impairment is due to avoidable causes, and cataract and uncorrected refractive error causes nearly 80% of all visual impairment. So that was distance visual impairment. What about near visual impairment? So 6.43% of the global population are affected by presbyopia. So nearly 510 million people can't see well at near because they don't have a pair of glasses. And 22% of people aged 50 and older had vision impairment from uncorrected presbyopia. And again, most of those affected with mild vision impairment and vision impairment from uncorrected presbyopia resided in South Asia, East Asia, and Southeast Asia. So we can see that uncorrected presbyopia causes 3 times more vision impairment than any distance causes. And if we don't do anything, we know that the number of people with vision loss is growing. Okay, so in 1990, the number of people with vision loss was 568 million, and in 2020, it's 1.1 million, and this includes near vision impairment as well. The numbers that I quoted earlier did not include near vision impairment. And by 2050, we expect this number to go to 1.7 million. So what about myopia? So we know that myopia can be a bit of a problem. So if we look at the data, so from that paper that was published by Brian Holden posthumously, we can see that in 2020, nearly 34% of people were affected by myopia, with high myopia being 5%. But it is expected that in 2050, half the world's population will have myopia, with 10% of people having high myopia. So why do we worry about myopia? As optometrists, you know that if you are myopic and have high myopia, there are significant increases in the risk of conditions such as myopic macular degeneration, glaucoma, cataracts, and retinal detachments. So all of these conditions contribute to the burden of blindness and vision impairment. But on top of leading to potentially permanent vision loss conditions, not correcting myopia has also got immediate issues and consequences, such as affecting people's ability to work and to study. Right, so why does this matter? So I think in another presentation earlier in the series, they talked about universal health coverage, which is health coverage for all of the population without making people poor to access this sort of service. So eye health is an integral part to advancing sustainable development. Okay, under universal health coverage, everyone needs to receive the full spectrum of essential quality health services they need, and this includes eye care without suffering financial hardship. So universal health coverage isn't universal if it doesn't include eye care. So we need to remember that. In a lot of countries, there are quite good health policies and health plans, but often eye care is neglected. So why does eye health matters? Eye health is essential for achieving the Sustainable Development Goals, or the SDGs. Okay, so good vision and eye health can unlock people's potential to get an education, to earn a living, and to maintain their well-being. So if we look at it, we can see poverty is a consequence of poor eye health, right? So 90% of vision loss in low and middle income countries, which we said before. So people who are poor and extremely poor are among the furthest behind. So 90% of vision loss is happening in low and middle income countries. So if you improve eye health, it can increase household income, which then can reduce hunger. Okay, so that's SDG number 2. So you can have a look at the IPB website, which goes through all of these different sustainable development goals and why, and look at why it is important to address eye health. Okay, so eye health is also critical to reducing road traffic deaths and injuries, because unoperated cataracts can increase the chance of a motor vehicle accident by 2.5 times, for example. So I spoke about the Lancet Global Health Commission on global eye health paper. So that paper found that providing cataract surgery in marginalized communities can increase household incomes and alleviate poverty. Addressing vision loss can increase household expenditure by 36 to 88%. And providing cataract surgery can increase household per capita expenditure. So if we look at the economics of vision impairment, looking at the numbers in 2020, 18.1 million people are blind in the working age group, and 142.6 million have moderate and severe vision impairment. So this was estimated by the Lancet Global Health Commissioners to cause a 30.2% reduction in employment opportunities if a person was blind or had moderate or severe vision impairment. And this led to a global loss of productivity of 410 billion US dollars. And by addressing vision loss, it can increase relative productivity by 22%. So this has got, so vision loss, if we leave it untreated, can actually have a great impact on the loss of productivity. So what can we do about it? So the World Health Organization and the International Agency for Prevention of Blindness came together to form Vision 2020, the Right to Sight, which is a global initiative for the elimination of global blindness. So this happened back in 1999, and that's the aim, to eliminate avoidable blindness by the year 2020. And they expected to be able to reduce the projected blindness of 75 million in 2020 to less than 25 million. And Vision 2020 is a partnership of the WHO, the non-governmental development organizations and professional associations and people involved in eye care delivery. In 2013, the Global Action Plan was launched, and it had a global target to reduce the prevalence of avoidable blindness and visual impairment by 25% by 2019 from the baseline in 2010, and to have universal eye health and to improve eye health for everyone. So this is the journey towards accessible quality eye care. So Vision 2020 in 1999, then there were several World Health Assembly resolutions on the prevention of blindness. In 2013, the Global Action Plan, and in 2019, the publication of the World Report on Vision, which was released on World Sight Day in 2019. So the World Report on Vision provides the best evidence on global magnitude for eye conditions and visual impairment, and looks at the progress that's been made and the remaining challenges that faces the eye care sector and the priorities for action. So one of the things that it really promotes is the implementation of eye care that is people and community centered and not disease centered. So these are the 5 recommendations from the World Report for Vision, which is to make eye care an integral part of universal health coverage, to implement integrated people-centered eye care in health systems, promote high-quality research, to monitor trends and to evaluate progress, raise awareness and engage and empower people and communities. So to implement, I've chosen one of the goals. To implement IPAC in health systems, it talks about effective coverage of refractive error and effective coverage of cataract surgery. So, which are the leading causes of vision impairment and blindness. So optometrists obviously have a big role in this sort of work. And to make sure that there's an eye care workforce as part of the healthcare workforce planning in countries. Okay, so, and a summary of the Lancet Commission key messages. So again, you can see that they speak to each other, the Lancet Commission and the World Report on Vision. So eye health is essential to achieving the Sustainable Development Goal. So we need to reframe vision as a development issue. And almost everyone will experience impaired vision during their life course and will require eye services. Eye health is an essential part of universal health coverage, which echoes the World Report on Vision. And high quality eye health services are not universally delivered. And we need to do something to improve quality and outcomes to provide effective, efficient, safe, timely, equitable, and people-centered care. Highly cost-effective vision restoring interventions offer enormous potential to improve economic outlook of individuals and nations. So we need to have a major scale up of financial investment in eye health. So the 10 findings. Financial barriers to accessing eye care leave many people behind. So eye health needs to be included in national eye health financing mechanisms to pool risks. So technology and treatment developments offer new tools to improve eye health. Although we need to make sure that we maximize the potential to improve coverage, access, quality, efficiency, and affordability, because often the technological and treatment developments are available in high-income countries, but doesn't come down to the low and middle-income countries. So the current eye health workforce is not able to meet population needs in many countries, and we need to increase the service capacity. So there are activities now looking at how we can address this based on eye health competencies rather than individual cadres. And we need reliable surveys and service data to measure what's going on and the progress in eye health. Okay, so robust indicator data to shape and change and drive action. So you will be seeing things around effective cataract surgical coverage and also effective refractive error coverage being talked about as the indicators for eye health. And research has been crucial to advances in understanding and treatment of eye diseases. So, but we still need to do more research to deliver innovative prevention and treatment strategies and to inform implementation of eye health within universal health. So with all the work that has been done, where are we now? So for age over 50, which is where we've got most data from due to the rapid assessment for avoidable blindness surveys. So it has actually decreased for the prevalence of blindness has decreased from 2.59% worldwide in 1990 to 1.84% in 2020. And moderate and severe vision impairment has decreased slightly, has increased slightly, from 10.9% worldwide to 11.1%. Okay, so blindness has reduced by nearly 30%. So if we did not have any interventions at all, the prevalence of blindness would have gone up. So what about optometry? Where do we sit? So if we look at the eye care workforce, there are 238,000 ophthalmologists worldwide, 340,000 optometrists, and another 218,000 also allied health or allied ophthalmic personnel. So if we look at where the ophthalmologists are, so this graphic here shows you the median ophthalmologists per million by the GBD super regions. So you can see that most ophthalmologists are located in the high income countries. So that's 80 per million. And in Central Europe, Eastern Europe, Central Asia, 71. But if we start looking at South Asia, where India is, there's only 10. And if you look at the Southeast Asia, East Asia, and Oceania region, that's 9. So high income countries has 8 to 9 times more ophthalmologists than low and middle income countries. And if you look at sub-Saharan Africa, the numbers are quite scary. It's very, very low. And if we look at the number of optometrists, again, we can see an overwhelming number of optometrists being in the high income countries. Okay, so mostly, this will be mostly in the Americas, Australia, and UK. So, and if we look, the next highest number is around the Central European region, but 156 per million compared to the European region of 48. So that's quite a significant difference. And if we look at South Asia, so we've got 10 and 5 in Southeast Asia, East Asia, and Oceania regions. So optometry is still very underdeveloped in the Southeast Asia, East Asia, and Oceania regions. And we really need to increase the workforce somehow in these areas. So what can you do as optometrists? So optometry has a role in integration and providing services for all. So through innovation, different models of practice, community level connection, integration into public health system, and having and leaving no one behind. So if you look at the Lancet Commission paper, refractive error is in the top 5 challenges, grand challenges in eye care going forward. It's a pathway to other eye care needs, which you know. So when patients come in for when they first become presbyopic, there's an opportunity there while you're checking their refractive error to check their eye health. Okay, and optometrists can have a leadership and advocacy role for refractive error. So I would urge you to have a look at this blog, which was published as part of World Optometry Day, Challenges and Opportunities for Global Optometry in the Next Decade, written by Priya, I think, who presented to you last year. And in this blog, she talks specifically about the grand challenges in eye care. So optometrists can also show leadership. So where does optometry have leadership? You know, it could be in areas like myopia as a public health challenge. And this was a blog for World Optometry Day written by Professor Koban Naidu, another blog that you should have a look at. So we can show leadership in raising awareness on the impact of high myopia, for example, research, human resources, so development of human resources for eye care, and again, for integration of services, and advocacy and policy change. So what can you do? So you can think of your role as a health provider and from a public health perspective. So you can look at providing affordable services and spectacles to the community. So optometrists work at the level of the community. So this is so you actually have a big role in providing integrated people-centered eye care. Okay, so you can also have a role in health promotion, providing community education, conducting vision screenings in schools, or outreaches to areas where people can't access services, work with other professionals to provide integrated services. So very often optometrists work in standalone practices, and you don't integrate or communicate much with other healthcare professionals. I would urge you to work with others, communicate with your local GPs about the patients, your mutual patients who have diabetes, communicate to them about the status of, whether the patients have diabetic retinopathy or not. Work with ophthalmology, so refer patients to them for cataract surgery, help them to co-manage post-cataract surgical patients, and even glaucoma patients. So you can manage patients in the community together. You can have roles in advocacy. So for policy change, from recognizing optometry as a profession. I think this has happened recently in India. So congratulations to all of you in India about the services that you provide. Coverage, health insurance coverage for the services that you provide, and glasses. And you can also have leadership roles. So set examples for others. So, and you can actually act fairly quickly. So the IAPB yesterday announced an advocacy to action course. Which is in collaboration with the World Council of Optometry. So this advocacy to action agenda, to quote Sandy Block, who's the head of the public health subcommittee at the World Council of Optometry, she believes that the advocacy to action agenda will lead to initiatives designed to change the delivery of eye care and subsequently reduce the magnitude of preventable vision and eye health problems. It's a 6-part online program consisting of workshops and webinars that will run from April to December. And the first webinar is an introduction to global eye health advocacy, and it's on the 13th of April. It's a free course, and it features 2 of my colleagues, Brandon Atong and Elise Mu. And one of my eye health heroes, Dr. Jambi Garab from PNG. So you can act today, and after listening to this presentation, sign up for the course, and you will be an advocate for eye health. So thank you and stay safe. And that's my contact details if anyone would like to communicate with me for anything. Thank you.
Okay, so thank you, Dr. May, for that very insightful talk. I think these are the things which any optometrist must know, and you did mention that everybody has their own role to play. So what can you do? That's the most important message, right?
Yes, absolutely.
In the meantime, while the questions are coming in, Dr. May, just a thought about you did mention that everybody has a role to play. So I did ask this question to other people as well, but I would like to get your opinion on the importance of how can a private practitioner be, play a role. What are your thoughts on this aspect? If I'm a standalone practice working in a retail setup, at hospital as academic institutes, we go for screening programs. You did mention the importance of that as well for preventing and giving visual correction and all that. Any tips on private practitioners' point of view?
Okay, as a private practitioner, you still have a role to play because private practitioners, so in terms of integrated people-centered eye care, where do private practices sit? You sit in the community. You are not necessarily in a central hospital far away from the people. You are located exactly where people live, and so you're able to provide services. So your role in just providing eye care to the community where you are, that is your role already. So you're already playing a role as as a service provider, if you like. But you can certainly go and talk as a private practitioner. And I know in Australia, some of my colleagues in private practice do this. They may make connections with the local community groups. So you can see that a lot of people who have problems with their eyes are elderly. So there are sometimes there are community centers that they go to and clubs that they go to, and you can certainly go there and provide eye health education. Because believe it or not, even in Australia, the highest cause of like mild or moderate vision impairment in the elderly is uncorrected refractive error. And we've already shown you, we've got optical shops and optometrists everywhere in the community, and yet people's awareness can be quite low. So one of the things you can do is certainly awareness raising among the community where you are. And the other role that you have is, I know a lot of optometrists only provide refraction services in Asia, but you're all trained to provide much more than that. And I know a lot of people also do provide a lot of other services, such as, diabetic retinopathy screening, for example. So every patient who comes to you with a health, with a history of diabetes, or you should really be having a look at the fundus and dilated fundus if possible. But even without dilated fundus exams, I know there are people with non-mydriatic cameras and things like that you can actually use to have a look at the back. And if you're in a well-to-do enough practice, you might even have access to OCTs and that sort of thing. So again, that's something you can do. And if you find a patient with diabetes, you've had a look at the back of their eyes and they have no diabetic retinopathy, that's great. But you can still talk to the patient about, looking after their diabetes and to come back to you if they notice anything, and when they should come back to you for a routine diabetes screening. And the other thing that you should do is find out who their GP is and write to the GP and tell the GP, your patient, our mutual patient came and saw me today, and he said his diabetes is under good control. He has no diabetic retinopathy. I have advised him to come back in 12 months' time for another diabetes check. So this sort of thing is how you would integrate yourself into the health system.
Yeah.
So don't think that you only need to write a letter if there's something wrong with the patient. So sometimes if you find diabetic retinopathy, you will write to the ophthalmologist, right? To ophthalmologist to refer the patient. But when you're doing that, copy the letter to the patient's GP. Find out if the patient has an endocrinologist, copy that person as well. So this is all about integration. So then you're actually not in a standalone position, but you're integrating your care into the health system. And if you keep doing that, after a while, the GPs and other medical practitioners will will then realize that, optometrists do more than just prescribing glasses. So it's kind of on you as well to spread the message.
That's right. Yeah. So it's a win-win situation, and also I mean, in the recent years, we do have understand that optometry is a multidisciplinary approach profession
Yep.
already, right? So I cannot recollect which paper. I did read a paper which said on the similar lines what you're talking, that the optometrist tied up with the diabetologist and the nutritionist, and
Yep.
all these patients were referred to the optometrist for eye screening. And then the optometrist referred all patients who had diabetes to these diabetologists. And the ratio turned out to be very, very high. About 35 or 40%, if I may recollect, didn't even know that they had diabetes or there were signs of diabetic retinopathy. So that's a huge number, and we can cater to that. As you mentioned, we are trained to do a lot more than just refraction, right?
Yep. Yes. And so we can't sit in our clinics by ourselves and complain that, why isn't that GP sending me his diabetes patients for diabetic screening? Maybe he doesn't know you can do it, or maybe he's not convinced you can do it.
That's right.
But if you're seeing the patients that are coming from the GPs anyway, if you regularly write to them, eventually it will click that when they have a patient, they might think, oh, I would like to have diabetes screening for this patient, and then they'll send it to you. And that's one example. The other example is glaucoma. With glaucoma, you have to do lots and lots of visual fields and follow up. So we had a situation where glaucoma patients were going to the eye hospital, and the eye hospital couldn't cope anymore. They couldn't cope with just the ongoing monitoring of these stable glaucoma cases, for example. So then they sort of started thinking, all right, we push them back out to the optometrist, and the optometrist will do the monitoring of the pressures, the disappearance, and the fields. And if anything changes, then the patient goes back to the hospital. So again, this is all integrated care, which a private practitioner in a practice can have. But again, you need to proactively go and seek this sort of opportunities and to advocate. So the glaucoma thing didn't happen easily. So you actually need to advocate for this sort of thing.
Yeah, that's right. And I think you did also mention about the Indian optometry, just taking the Indian optometry, because the law was just passed by the parliament, and
1 week ago.
About this week. It was on the 25th, 24th, just the next day after the World Optometry Day. So we will now celebrate World Optometry Day and Indian Optometry Day. 2 days of optometry in a year on our calendar. But that being said, I did attend a couple of webinars talking about this, the bill getting passed, and the role of optometry will now become more important, and public health is something which will really boost up, because I mean, I can't reinitiate your words. I can go on, and we can go on. You can go on talking the importance of how we can play a role. So I think, and do you think it's the same in developed countries like Australia and the US, the way optometry is in terms of integrated care?
In Australia, so the examples that I provided to you are Australian examples. So, so the glaucoma clinic was something that, the eye hospital in Melbourne, they figured out that they just can't manage anymore. So they started developing these models. But in reality, we are always doing this stuff anyway. We are monitoring the patients, we're doing everything. And in Australia, we're fortunate enough to have therapeutics, which means that we can actually prescribe eye drops and that sort of thing for the glaucoma patients. And that said, a lot of optometrists will still work with the ophthalmologists, because with the complicated or complex cases, I think we know our limitations, and we don't have a lot of cowboy optometrists out there trying to push the envelope. And optometrists are quite conservative by and large. So far, I don't think because the ophthalmologists were quite against optometrists prescribing glaucoma medication because they thought, the patients will die from some of the medications interacting with other medications and that sort of thing. But that said, I think until now, there's been no cases of any sort of malpractice from optometry prescribing eye medications. So it's quite safe. And the diabetes model, I used to run a diabetes clinic, and that is what we used to do. So when I teach my students, back in the days when I teach, I always force them to write letters to the GP, to the endocrinologist, and whoever else needs to know.
Yeah.
So it's happening. But with diabetes too, sometimes I can think of, so the government also tries to push the GPs to develop care plans as part of an integration. So they would have to refer patients to an endocrinologist, a podiatrist, a dietitian, and an optometrist, and get letters back. And if they can successfully do that, they will get an additional payment from the government health insurance. So that was a way the government pushed the integration as well. But, it's really, so it's something that happens. There's a lot of communication back and forth within the profession. But you as an individual practitioner also needs to drive that.
Yeah, that's very important. And as the first poll went off, we saw there are a lot of retail practicing optometrists. So probably this would be a kickstart for all of them, that you now start to integrate your practice with other medical professionals, nutritionists, diabetologists, and cross-referencing, and writing letters to them, referral letters, and would help.
Yep. And I think one of the ways is to be informed. And to learn how to advocate.
Yeah.
So I think the IPB advocacy to action courses will be a good step forward to that.
All right, great. So thank you, Dr. May. I think we did cover a lot of important things. And thank you so much for doing the talk and also sharing the latest information, which was just released within a couple of weeks back. And one of it, which you mentioned about the advocacy to action plan, which was just released a couple of days, I guess, back. And
thank you last night, actually.
Last night. Okay. So thank you for keeping us up to date. Thank you so much, Dr. May, for doing the session for us.
Yeah, you're welcome.
Just a couple of announcements before we wind up for today. First of it, that we are finishing about 1 year of this continued education learning program, online Optom learning series. And to advocate the profession as well, we have launched some Instagram and Facebook kind of filters, which are some instruments, basic instruments, which we use in eye examination. So we have a contest running on Facebook and Instagram. So you can use these filters, show your creativity on this thing, and help to promote optometry to the general public. Tag the two people mentioned on the slides, and you could be one of the winners for being the most creative optometrist or optometry student, probably. We have about 5 gifts or prizes to be given away. So hurry up and post in your entries. The last date is on 3rd April. So thank you everyone for attending today's session. Being Holi tomorrow is a festival of colors and being celebrated in India, majorly in India, but I think people who do celebrate Holi wherever in the part of the world you are, happy Holi in advance, which is going to be celebrated tomorrow. Take care, be safe, and I will see you all again on Thursday probably. Take care and bye-bye.
Bye.
Thank you, Dr. May. Bye-bye.